The single port robot has revolutionized our care of throat tumors here at HCA HealthONE Swedish. If we were doing traditional surgery, it's likely that we'd have to make external incisions, make a cut through the jawbone, and then make additional incisions within the mouth just to see the back of the throat, just to see the tonsil or the back of the tongue.
This has changed the game completely. With the single port, we were able to bring our camera and articulated arms into the mouth of the patient, bring that binocular magnification very close to the site of surgery.
That camera can flex and move in all different directions. And so I'm able to look down, up, and see views that honestly I wouldn't be able to see if I was just looking through the mouth. Through that same port, we have 3 instruments that knuckle and angle and do things that if I was using just my hand or my fingers, I wouldn't be able to achieve that in the small space of the mouth.
With those articulated instruments, we can minimize the surgery, at the same time making sure we get all of the cancer. The smaller the wound, the quicker the recovery. Most patients are in the hospital anywhere from about 3 to 5 days. They're drinking immediately after surgery, and they're often back to work within 3 or 4 weeks.
The sooner the patient comes to us, the sooner we can figure out what the best treatment for the patient is, whatever aligns best with their wishes, and also get them to the treatment itself. Over time, tumors can grow, and so time is very important.
The candidates for single port robotic surgery really are patients with early stage tumors, T1, T2, maybe some small T3 tumors, and even then the anatomy has to be right. So the position of the tumor relative to the carotid artery, relative to some of the musculature along the jaw is really important.
When you think to refer your patient to a surgeon, that doesn't necessarily mean you have to know that they want surgery or that they're a surgical candidate. It's very nuanced to determine who is adequate for surgery and who's not. And so having to make that decision when you don't have the background or expertise can be a bit daunting. And that's why we ask that referring physicians think about us. We're happy to start that evaluation. We recognize that surgery may not be best for every patient, and for that reason, we really think of ourselves as a quarterback of care. We like for patients to start with us because we have access to imaging that can be done quicker. We make sure that they can get in to see radiation and medical oncology the same week sometimes, and so often we can expedite the workup that takes a little bit longer on the outside.
So radiation is a great treatment for the right patient, including oropharyngeal cancer patients. But the long-term side effects of radiation include dry mouth, which has an impact on swallowing, has an impact on taste, has an impact on long-term dental care, and there's a risk of radiation-induced tumors that can come many years afterwards, and keeping in mind that many of these patients can be young as 35 years of age. So when we talk about treatment options, we're really thinking about what is the quality of life for these patients who are young and may live as long as 50 or 60 more years. We want to make sure that they not only just live, but live their best life. We provide updates and a written survivorship plan once they've been treated. So what should these patients be looking for after treatment? And we give that both to the patient and to the primary care provider so that they can be looking for those things, so that we're working as a team with them.
We keep track of that patient and work as their surgical oncologist. We take the surveillance onto ourselves. And so we think about all the supportive care, whether it be physical therapy, speech and swallow rehabilitation, nutrition, and general health maintenance. I always tell my patients that this is the beginning of a long relationship. And that's because I will continue to see them regardless of whether they undergo surgery or primary chemotherapy or radiation for at least 5 years. We want to make sure that the patient is thriving and getting back to their normal lifestyle. Dr. Vandersloot and I take a lot of pride in our practice and our process. We really believe in multidisciplinary care. And when it comes to this type of surgery and a lot of head and neck tumors, we're the quarterback. And really, a timely referral to us will get the patients what they need, be it surgery or non-surgical treatment for their tumor.